Good afternoon, and welcome to the Quest Diagnostics sponsored webinar, Blockchain in Healthcare, Why It Matters. My name is Colby Dix, and I will serve as your moderator and host today. This session is an interesting one, and we're excited to have you all with us. Our overall agenda is on the screen for you now, illustrating the 4 primary questions that we will address during today's session. There will also be a Q&A session directly following. Stay with us for that. I'd like to extend a warm welcome to our presenter today, Lydia Fonseca. Her bio is up on the screen now, and you can see that we're quite lucky to have her available to us. As the Senior Vice President and Chief Information Officer for Quest Diagnostics, she is one of the leading voices in the industry when it comes to innovation in healthcare. Last year, she received the Forbes CIO Innovation Award, and she's directly involved in the recently announced partnership with Quest Diagnostics, Humana, Multiplan, Optum, and United Healthcare to take a closer look at how blockchain technology can improve data quality and reduce costs, specifically in regard to provider demographic data, which you'll hear more about shortly. Lydia has a storied history in healthcare technology with impeccable credentials, and her knowledge and insights help to guide all of us here at Quest, and her continued contributions drive the conversation forward for the entire industry. Welcome, Lydia Fonseca.
Thanks, Colby. Glad to be here today.
Thanks so much. It's good to have you. I guess we'll dive right into our feature presentation. For almost any burgeoning technology, there tends to be a little bit of confusion around its essence. And blockchain is no different in that regard. Lydia, for the sake of today's conversation, would you be so kind as to go over some of the basics of blockchain technology so that we might set a baseline for how it might be utilized in healthcare?
Sure. When I get this question, what I like to share is that at its basic level, a blockchain, the way to think about a blockchain is that it's a shared distributed database or ledger to collect, share, and exchange information. And as you can see on the screen there, blockchain is most useful when loosely coupled organizations want to exchange and share information, but also automate mutually beneficial processes. You'll see that a blockchain has a number of key components. I mentioned the distributed database. It also has what we call an append-only structure, because what you're creating is a single source of truth with immutable records. That means that as they get updated, you keep track of them, but you always have the most up-to-date version. Smart contracts is a third component, where you really, have some very clear contract elements about how the processes are going to be updated and reconciled. And then usually there's also incentives, because you want to align the incentives so that participants are not only inputting value into the blockchain, but also being able to transfer value out of the blockchain. So the incentives are important so that you really get that network effect. And that's, would be the basic definition of a blockchain. If you look at the history of blockchain, most of you may also know that Bitcoin, blockchain underpins Bitcoin. And in fact, Bitcoin was the first blockchain application. And if you think about it from it's an unregulated shadow currency, and it's very resource intensive. I think the difference when you think about blockchain and applying it in a business setting is that it differs in a number of key areas. Number one, and very, very importantly, we value identity over anonymity. The second element is that it is about selective endorsement over proof of work. And the other key difference when you apply blockchain in a business setting is that we talk about assets, in our case, information assets, over cryptocurrency. But in case you're wondering, we are not applying cryptocurrency to the blockchain applications that we're going to be talking about today.
Excellent. And now that we've established a basis for blockchain, a little of what it is and what it isn't, I'd like to ask you more specifically about Quest Diagnostics and some of the potential applications that they would see for the technology in the near future.
Sure. So, we definitely have a number of ideas about where we think blockchain, could be leveraged. I think, what we like about blockchain in healthcare is that it can really enable trusted, secure business networks across multiple partners. And this is really important because in our industry, right, if you step back and think about healthcare, the consumers of healthcare services, right, the patient or the consumer or the member, is not the same who orders those services, because that tends to be a provider. And it's not the same who pays for those services, because that may be a payer, like an insurance company or an ACO, or it could be an employer. So what's important and why we are excited about blockchain is that it really does enable companies to go beyond their company boundaries, or participants, right, can go beyond their company boundaries to be able to actually transact and exchange information. And so if we think about what blockchain can do, we like the fact that it can save time, and all of us in healthcare can really get behind that. It can make us more efficient by removing inefficiencies and unnecessary costs. It can reduce risk, right, because transactions become more verifiable and auditable. And very importantly, it increases trust, because if the participants that are participating are going to update processes, it aligns our record keeping and gives us real-time information. So as we think then about that, here at Quest, the top use cases that we're thinking about, one is provider data exchange. And frankly, even though we're starting with provider data, really the topic is data exchange. How can we update records once and then broadcast them across to the various participants so that each of us independently don't need to be chasing for information updates and, when we have incomplete or inaccurate data. The second use case that we've been thinking about is chain of custody, right? We have samples that we as a diagnostic company, keeping track of samples is a key part of what we do. And we believe that there's a chain of custody application which we feel could also have great potential. The other use case that we've thought about is around, we work with a lot of different suppliers across our value chain. And so being able to manage our supply chain end-to-end, including our recall management process, could also be a great use case for blockchain. In today's conversation, we're going to focus on the first use case, which is provider data exchange. But you can see that we've definitely been thinking about other applications as well.
And with all of that potential, we will indeed focus for the moment on a single key benefit of the blockchain that can affect healthcare providers. And it has been well publicized that Quest is now part of a newly created Synaptic Health Alliance that is looking for some exciting uses of the technology across the industry. And Lydia, could you address for us now one of the most significant benefits of the Blockchain Alliance for us?
So I think if you look at the process of maintaining provider data today, those of us that are, participating in this alliance, we describe it as it's currently a door-to-door process and inherently has a few challenges. So if you think about, information is updated for one entity at a time. And that means, for example, providers must provide updates. Let's say they change their location, or they want to update that they're accepting patients, or they want to add a specialty to their group. They need to provide those updates to each of the various partners. If you think about it, I'm using the example here of health plans, right? So if the patients of that provider have different health plans that provide their coverage, that provider literally would have to update each record for the different health plans. And you can imagine that's time-consuming and inefficient, right, because they're having to do this individually. The other challenge is that updates are not broadcast. So ideally, the provider should be able to update their information, and then that's broadcasted, right, across all of the different participants who need to have this information for processing transactions and other communications that they may have with the provider. So this door-to-door process, number one, the information today has to be updated for one entity at a time. The second thing is that the provider must provide those updates individually to each of their transacting partners. And the third challenge is that updates are not broadcast across, so it does create this multi-set of steps for them. What that creates then is a provider experience that is not optimal, right? This results in quality issues, right? And it's either could be that there's incomplete or inaccurate information. So the health plan then has to reach out to each provider to ensure that they verify, what they have. The second, reason that experience is not optimal is that providers are already, overwhelmed that they want to be able to prioritize patient care rather than what we consider administrative, burden or administrative steps. So that experience takes them away from, really being able to focus on patients. And then, very importantly, this inefficient process is onerous, and it creates friction between the payers and the providers. And so, leading ultimately to an experience that we feel can be improved. And you'll see that there's been several studies that bear out that the process and experience of providers today, and you'll see, for example, CMS reviewed 54 out of 126 provider directories in 2016. And so they had, they looked at the information of almost 6,000 providers, right? And what they discovered in that study is that almost half of the provider records had incorrect information. About a third were listed at incorrect practice locations, and 15% had a wrong phone number. And then if you look on the right, there was a study done by Ernst & Young where, they looked at the information and the validity of the information. And what they discovered is that over an 18-month period, the quality of the information actually eroded. And you can see that it eroded to 50%, in terms of information that's now out of date or incomplete. And so, again, these two studies really bear out that the door-to-door process today, as well as the experience that I described earlier, it's no surprise, right, that there's a challenge when you look at the quality and the completeness of the data. So, this was one of the main reasons why we, Humana, Multiplan, Optum, Quest Diagnostics, and United Healthcare formed, this blockchain alliance, which is our Synaptic Health Alliance, is our brand name, and really with the idea of could we use the blockchain technology to help address some of the toughest, problems in healthcare. And if you think about it, if you've been in healthcare long enough, interoperability has been a consistent challenge in our industry. And the other one is, the completeness and accuracy of data. And so our first use case is to tackle the completeness and accuracy of provider data. And if you take it a little bit step further, even just basic information like name, address, phone, is that provider accepting patients or not, specialty, information. What we found is that the impact of incomplete and poor quality data is not only has a financial impact, but, for example, patients are seeking care from out-of-network providers, which adds more administrative burden and more cost. Providers endure unnecessary billing and administrative complications. That means that, the payment and the claims processing efforts take longer and take a lot of interactions in order for the provider, to have their answers and to understand the coverage. Health information exchanges and organizations cannot effectively enable the secure sharing of patient information because they have to make sure that the provider information is accurate, right? And, on the health plan side, they have higher, administrative burden and costs. And, because they have a requirement to maintain the provider directories, it puts them at risk of potentially violating state and federal requirements. So if you look at that impact, and then you see that the industry, particularly payers, they spend today $2.1 billion a year chasing and improving provider data. And we believe through the blockchain pilot that we're doing that we can reduce that by 75%. And just to give an idea of how, how the Blockchain Alliance operates, right? Again, we take those data sets. Each of us are now exchanging and updating the records. So all 5 of us that are participating updates those records in the blockchain so that when we update that, it then becomes immediately available to all the participants. And so this operation, this ability, to maintain and to broadcast those updates, and not only do we have the blockchain so that we can, real-time update and as well as, provide the broadcast, we're also operating a private, secure network. And that means that we have governed identity so that all transactions are digitally signed by known users. It is a permissioned blockchain, and that means that only trusted trading partners are in the mix. Confidentiality, transaction details are only known to the involved parties. And we've also, designed in this blockchain with a network security. That means that no trust is assumed between the nodes and communication is encrypted. What's important about this is that although our first use case, provider data, is public data, we are creating a secure private blockchain that has privacy and security built in anticipation that, that there will be other use cases in the future that include sensitive data. We already are designed, to protect and to ensure the privacy. The benefits that we see from the pilot, really go across, right? If you think about the benefits for providers, fewer require updates. It'll save them time. It'll save them cost. They'll have higher satisfaction with the payers because it'll speed up payments and claims processing. So we definitely anticipate them, having less friction with the payers, but also saving them time so that they can focus on the patient, right? For the consumers, we believe that there will be improved access to care and better provider search experience because the provider directories will be up to date and they will know right away if their provider is in network. It'll improve the claims payment experience for the consumers. I think for payers, we definitely see fewer chased at the stations because today in that door-to-door process, they're having to send letters and calls and emails and visits. It'll definitely reduce that. And it'll also, should yield some cost savings from eliminating a number of synchronization efforts. And our expectation is with that less provider friction, it should yield for them a better net promoter score as well in terms of, satisfaction with their services in the industry. And then for the industry at large, we feel that this new enterprise blockchain platform can be leveraged for other efforts. And it also creates a partnership, right, that can be used to tackle, other industry-wide challenges. And I'll tell you from the experience, we've been working together, these 5 companies. I think it's really terrific that these 5 companies are willing to go beyond company boundaries to actually improve, the quality of information, speed up transactions like processing of payments, processing of claims, and all with the idea that ultimately we will yield a better provider and consumer experience. So, definitely see some potential benefits here that we're all excited about.
Yeah, it's really some very inspired thinking going on with that potential that you mentioned. It can greatly benefit not just the corporations involved, but the providers, the insurers, the patients themselves. It's a really positive place to be, an exciting time in our industry in general. And with that in mind, Lydia, what other technologies are on your radar right now that would have an impact on healthcare?
Yeah, we're always evaluating and looking at how technology and data services can improve and continue to propel us forward. I'll mention two today. Obviously blockchain is top of mind as well. But let me talk about two other technologies, and I'll start with artificial intelligence. And we definitely see some potential of artificial intelligence in our business, and definitely from the point of view of more precise medicine for personalized care. So one of the offerings that we have launched, and we launched this about a year and a half ago, is our Watson Genomics from Quest Diagnostics. And what Watson Genomics from Quest is that there's three steps to this. One, Quest sequences the patient tumor to identify mutations that may exist for that patient. Then we bounce it off of the IBM Watson capability that compares those mutations against leading science, therapies, and clinical trials. And then we take all of that in and pull it together, and we then have our experts review that, we validate that, and then we provide to the oncologist or to the practitioner, the clinician, a report that not only gives them the insights about their patient, but also provides context and next steps as to recommendations as to what to do in that patient's care. So, from our perspective, this is a great example of artificial intelligence, being used to really put insights in the hands of practitioners. And this is particularly important in cancer because 70% of cancer care is actually managed in the community setting. And, what we're excited about is that we're putting insights and innovation in the hands of community oncologists so that they can make better decisions about patient care. And that's, so we're excited about that capability. The second capability that I would share, and this is, again, a great one in the sense that if you've been in healthcare long enough, interoperability, has been a big theme for us. And Smart on Fire enables us to, as an industry, to create an ecosystem so that, FHIR type of services are then created so that we can seamlessly and securely use and, exchange insights and make these apps available across, for example, all the different participants, and that includes a number of EHRs as well as a number of us as providers. And these apps are built to really drive actions and insights that are needed throughout the workflow of healthcare. And what we like about it is that it really does start to create an interoperable ecosystem where we have applications that can exchange information, for example, with EMRs. And instead of us having to do point-to-point integrations, we can now leverage these interoperable resources, for example, for demographics, for labs, for vitals, for medications, family history. And rather than having to kind of create them and recreate them each time, we actually can access them from a library of apps that are available on the Smart on Fire ecosystem. So we're excited about that. I think two examples of technologies that we are leveraging and we're very engaged in that we feel are going to drive, better insights and ultimately lead to better decisions and make our environment more open and more interoperable.
Excellent. Thanks, Lydia. Yeah, Quest has really always been a company that has embraced technological change, but these particular initiatives really seem to have them at the forefront of some other significant changes in the way that we all work and live.
Absolutely. And, I think we at Quest are leveraging technology and data to empower better health. That's a big theme for us. We definitely see ourselves as being more than a lab. And, definitely we're bringing innovation to the market through our advanced diagnostics expertise. We definitely believe that healthcare is a team sport. So we definitely focus on partnerships and relationships with different types of companies across the healthcare ecosystem. And then, very importantly, we certainly are leveraging data, technology, and programs to support population health. And, we definitely have, really focused our efforts around how do we help our customers and our partners, meet their goals and continue to deliver quality care. Our digital transformation really touches all of the audiences that we serve. The consumers, we definitely have capabilities and a digital platform for consumers in the MyQuest solution. For providers, we have our healthcare provider portal that really offers simplified ordering and result tracking and a number of other services. And that's delivered through our Quantum HCP product. Health systems and health plans, we definitely offer them a number of analytics capabilities that include some, self-service analytics, data diagnostics, utilization management capabilities. That's a big theme for those groups. And then for our employees and employers, we have, some wellness offerings like Blueprint for Wellness, as well as, a number of digital capabilities that enable employers to be able to give and provide their employees with, services. And all of this we enable through Quest Quantum, which is our brand for all of our technology and data offerings. And in that portfolio, you'll see that we really offer analytic, clinical, and financial solutions, across our various customer segments, whether they're health systems, clinicians and practices, or health plans. And then we have the engagement platform for the consumers, the providers, the care coordinators, so they can actually access all of these various, capabilities and services, all online through a mobile device or on a web-based platform. And again, the idea is that we really are creating solutions that enable them to make better decisions at the end of the day.
Outstanding. Thanks so much for the presentation, Lydia. It was really quite informative. We would like to open it up now for some questions from our live audience as we move into the Q&A section. And we do indeed have a few questions here already. Some of them are quite similar to each other, so I'm going to do my best to paraphrase them a bit and kind of push them together. So my apologies to those of you asking the questions if yours gets reworded slightly. One of the topics that's come up here somewhat repeatedly essentially is within the alliance, who owns the data and will it be used outside of that system in any specific way?
Right. So the idea behind the alliance is that this is a cooperatively owned blockchain instance, right? And the way to think about it, rather than who owns the data, basically what we're doing is each of us has a set of providers, right, that are in our data set. And think of the alliance and the blockchain as we provide updates to our provider data set, right? And those updates then become available real time to all the participants in the alliance. Now remember, provider data is public data, right? So if you're speaking about that specific data set, and really the benefit of the blockchain is that whenever any of us makes an update, it becomes immediately available to the rest of the participants. So ideally what we're doing is we're creating the most up-to-date, most accurate, more complete information, but the data set itself is public data. What we're leveraging from the Alliance and from the blockchain is that we provide updates, but then we also receive updates. So the benefit is that we have the most up-to-date information on that provider. And so when we're processing payments or we need to communicate with providers, the benefit is that we actually have the most up-to-date, complete information. So hopefully that gives. And then to your question as to is our plan to use the data beyond that, really the idea is that we will use the data for the transactions that we support today. So for example, payment processing, claims processing, updating provider directories. So but what we're doing is we're speeding up those efforts, those transactions to actually, reduce time and reduce costs, but more importantly, improve the quality of the data and then be able to respond, quicker to the providers and ultimately to the consumers regarding their claims. So hopefully that gives you that perspective.
Yeah, I think it answered it nicely. The next that I'm going to throw at you is at least two parts. I'm trying to once again kind of push a couple of these together as we focused a lot on provider data based upon the pilot. But there's a number of questions that have come in with the potential for an opportunity to also unify patient data, both PHI and other information there, and a concern, of course, using the potential to use unique patient and person identifiers and how there's regulations against that. I suppose to try to consolidate, how will that impact the implementation of the blockchain, and is there a potential for use of this for patient data beyond the provider data?
Right. So I think great question. Thank you for that. If you think about the goals of our pilot, number one goal is the three goals that we're setting for ourselves on the pilot. The first one is we have the goal to improve the completeness and accuracy of provider data. Number two, we want to be able to show that by doing so, we can also drive efficiency in the transactions that provider data feeds, right? I spoke about payment processing, provider directories, and claims processing. So the second goal is to drive efficiencies, and we should be able to measure those. The third goal that we have for this pilot is to prove that we can leverage the blockchain technology to achieve these goals. So our first step is to achieve these three goals. We started with provider data purposely, right? Because we knew that is a data set that didn't have, some of the elements at this point of privacy, right? It was really, let's get these first goals completed. However, as I mentioned, right, the way we're designing the blockchain is that it's a private, secure, permission network. And so our expectation and our hope as an alliance is that while we're starting with this pilot and its provider data, we very much believe that there are other applications of blockchain, and we do see that patient data would be a future use case. Our first step will be to complete the pilot, prove the case, and come back and share the results and the learnings that we have. But we certainly envision that one of the use cases in the future will be patient data.
Next question is a little bit more in the weeds in terms of a bit more of the specificity of the blockchain, which hopefully we can answer this time. But how are the forks in the blockchain handled without proof of work, and what determines a valid chain?
From our perspective, right, because we are very deliberate in terms of the participants, and remember I mentioned about the elements of the blockchain, and I talked about the different pieces of it. The way that we are, because of the first pilot that we're starting with, right, each of us, so think about each of us has a node that we've stood up, the 5 of us that are founding members. And we are starting in one market, right? And we do an overlap analysis of the data set in that particular market for each of us that are participating. And so, as you think about, because we are going through and vetting, and each of us that are participating are committing to, the specifics of it, then we are, our expectation is that we're going to be looking at the performance, and we're going to be looking at the rates, the matching rates, and the accuracy levels, so that, when we talk about endorsement, if we have a participant in the blockchain, we've vetted them, we've actually done the overlap analysis. So we've done a number of different steps that, and rules in the process, that when we say, okay, we now know the accuracy, we know the completeness, and we know the process that this partner, that participant in the blockchain, then we, our aim is that we will be able to say, okay, when this gets updated by one of those partners, it meets our requirements for completeness and accuracy and the steps that they've gone through, that you can then say this is selective endorsement because of, we've already done an analysis and we've already seen what their performance and what their commitment is as part of the process. So that's the way we're approaching it. It's also why we're doing a pilot, because during the pilot process, we really are fine-tuning and we really are, vetting the steps that the participants go through. And then we actually go back and look and analyze the results. And we actually have some very specific metrics and criteria. So if they meet certain criteria, then we know that this is a highly endorsed, participant. But we definitely have that, those kind of elements defined. And as we go through the pilot, we are checking for that to ensure that we can do the selective endorsement over the proof of work.
Excellent. Thank you. We have time for one more question here today from the live audience. Once again, rest assured, any of the questions that remain unanswered, we'll reach out to you directly. Lydia, the last question today, you touched on artificial intelligence, but do you see space for virtual reality also having an impact on healthcare? And if yes, in what aspect?
Yeah, that's an interesting question. I think that there probably are, some elements. I'll tell you, artificial intelligence for us, it kind of ranks high because we're trying to speed up, the diagnosis, and we're trying to, really evaluate a lot of information so that we can, help somebody make a decision. So think about clinical decision support. If I think about virtual reality, I can envision certain use cases where, which certainly can be applicable. Not as much, as much in our business, but, you can certainly see, for example, in some of the, let's say, imaging, for example, would be a good use case. Potentially, some of the surgical or pre-surgical kind of settings. So I do think there could be some application. It's kind of early to tell what of those applications could, become something, but I think there is. We haven't, just because when we think about blockchain and artificial intelligence and some of the intelligent assistants, we see us having more immediate applications to our business. But I think there'll be more to come on the virtual reality for our industry. But at this point, we certainly are. That's a little bit further out for us than I'm prepared to speak to specifics at this point.
Very good. If any of you have more questions about quantum practice or enterprise content solutions or any of the other technologies that we've spoken of today, please feel free to call or email using the contact information on your screen now. Once again, we thank you all for your attendance today. Special thanks, of course, to Lydia. and of course to Quantum and Quest Diagnostics for sponsoring the event. Do keep an eye on your email inbox for additional seminars covering related issues in the near future, and this will conclude today's presentation.